A warm welcome on behalf of the Nigeria Movement for Immunization Agenda 2030 Immunization Collaborative, a partnership between the National Primary Healthcare Development Agency, UNICEF, the Geneva Learning Foundation, and Gavi, the Vaccine Alliance. In just about 1 minute and 30 seconds, you are going to hear the voices of health workers from all 36 states, more than 300 local government areas, who in July and early August came together for the first time because they decided to make a difference for the children and families of Nigeria and decided to go above and beyond in order to ensure that every child, every family is protected from vaccine-preventable diseases. We're counting down 1 minute and 4 seconds, and of course, I'm here with Charlotte and Boo. Will be your hosts, but this ceremony today is about health leaders all over Nigeria, Charlotte, isn't it?
Definitely, Reda, and it's a real pleasure. We are looking forward to hearing them tell us what they took away from participating in the peer learning exercise.
Wonderful. All right, 35 seconds. We already have so many messages coming in. Wherever you may be, we're sharing this on LinkedIn, on YouTube, Facebook, X, Twitter, and other channels. So wherever you may be, a warm welcome to you. If you're joining from Nigeria, or if you're one of the international partners, observers, who's interested in learning more about this, this is very much the best way, the best place to be for this collaborative. So 10 seconds, and here we go. Challenges we face in our communities are not limited to us alone. Many face similar and even more challenging issues.
Issues seem to be simple, but they are interwoven. A solution requires multiple approaches.
Root causes often have systemic issues that need to be addressed in order to be solved.
I learned how to do a root cause analysis. I realized that vaccine hesitancy is not the only reason for missed vaccination.
These are just 4 of the testimonials from health leaders across Nigeria who participated in the first peer learning exercise of the Immunization Collaborative of the Nigeria Movement for Immunization Agenda 2030. A warm welcome to you. We're about to kick off this commencement ceremony. We're going to do 2 things today. One is to tell you the story of the launch of this collaborative, with some of the early learning and early promises, results from the collaborative as well. We're going to start with Chinwe Enechukwu. Chinwe, we'd like you to introduce yourself. You are part of a group of very impressive women leaders who joined the collaborative and made your voices heard. We thought we would start with you today, and I hope that your connectivity, yes. Please do introduce yourself, remind us who you are, where you work, and then tell us what did you learn in this first peer learning exercise about your own capacity to make a difference.
Good evening, everyone. My name is Chinwe Enechukwu. I am currently in Lagos State, Nigeria. I work with St. Nicholas Hospital here in Lagos. It's a private firm, although internationally known. What I learned about my own capacity to make a difference in this collaborative is, while I was doing my root cause analysis, I initially thought that it is something that can be done individually. But along the line, I found out that it's a collaborative thing. It's not an individual thing. But in my own capacity, I will do a health education every time there are women that comes in for antenatal in as much as I am not in the leadership cadre in my hospital, I have the right and the privilege to health educate women in antenatal care. So in my own capacity, that is the difference I will make about this collaborative. And I think it will go a long way in as much as there are so many other things to do. Thank you.
Thank you so much, Chinwe Enechukwu. What was different about the collaborative from everything else you have done before? We're going to ask that question to Usman Tijani. Usman Tijani, over to you with this question. And again, warm greetings to all those of you who've just joined us. Usman, do introduce yourself. Tell us who you are. Remind us who you are and what you do. And tell us what was different about this collaborative from everything else you've done before.
Yeah, okay. Good evening, colleagues. Usman Tijani is my name. I work with McKinsey Corporation, providing technical assistance in the area of polio and RCA immunization in northern Nigeria. So I'm in Zamfara in particular, where I give technical support to the state emergency center. So what I would like, or what makes a difference for me, my own side, is the collaborative effort that was able to bring people around so many different states within Nigeria, where we work together as a team. As one of my colleagues have just mentioned, we become a family at the end of the day because I was leading the team. So I worked together with them and we ensured that the root cause analysis was done in phases, looking at what is exactly there. Because my topic actually was lack of adequate manpower and poorly trained personnel. So this is one of the basic key challenges that is facing Northwest Nigeria in particular, or Nigeria as a whole. So that was an opportunity for me to meet different people from different backgrounds, but working together to achieve a common goal. So it was a great opportunity for me, and I feel this is a great step moving further. As a researcher, because I have experience in research, a research review, so I was able to coordinate the work, looking at what exactly you have in mind based on experience. And some of these people have been working in northern Nigeria for years. And at the end of the day, they were able to carve out, to provide solutions, and we work together as a team at the end of the day. So these are just some of the few things that I feel the collaborative effort was able to was able to bring us together to solve that particular problem. Thank you, and over.
Thank you very much indeed. We're just kicking off this commencement ceremony. We'll be recognizing, honoring over 400 immunization leaders, health leaders from across Nigeria, all 36 states represented, over 300 local government areas in what we've called the Nigeria Movement for Immunization Agenda 2030 Immunization Collaborative. Today is the day following the completion of the first peer learning exercise where we are honoring participants. We'll hear from one more person. We'll go to Sabatu Elizabeth Danladi. And we're going to ask Elizabeth if she would recommend the collaborative to her colleagues. She is from UNICEF. UNICEF, of course, is one of our partners. Charlotte, would you be able to help us connect with Elizabeth?
Definitely, Reda, and I hope Elizabeth is able to speak with us. So Elizabeth, I'm inviting you to unmute yourself. So please go ahead and do so.
All right, we're asking her to unmute, but there may be a technical issue. Let's go to Sandra Uyebi. Sandra.
Yeah. Hello, right. Can you hear me?
Yes, Sandra Uyebi, a warm welcome to you. Do introduce yourself, tell us who you are, where you work. And on this momentous occasion, this commencement ceremony, you are, of course, in the Zoom studio with us because we are going to honor you in today's certification ceremony. But you participated and successfully completed the first peer learning exercise. Would you recommend the collaborative to your colleagues? Why or why not? Don't forget to introduce yourself, though.
Yeah, my name is Uyebi Enosandra. I work for family center initiative for challenged persons, simply called FASIP Disability Plus. I would 100% recommend this collaborative to my colleagues. I've already started telling them about it. I've already sending them information about your organization and how they can put their ears down so that they can join when next you call for the next application. I'll do that because the benefit I got from the peer learning was great, really, really great. I've come across the 5 whys before, and I've been seeing it so difficult to understand. I don't know how to apply the 5 whys to come out with the root cause of any issue. It was somehow very confusing to me. But with this peer learning, I was able to understand and comprehend how to apply the 5 whys and get to the root cause of any issue, any problem we want to tackle, and get solution to it. And what really interests me is that during the process, we are able to see that from each step, we kind of, try to make up our action plan from it unknowingly, because my own topic was on the exclusion of children with disability from immunization process in the rural area. And so the 5 whys was able to make me write out my action plan, my work plan to easily. So the 5 whys that I learned, the techniques and the way you people, impart the knowledge on us. I believe it's not only me. I heard a lot of my colleagues saying that some said they've not heard about it, but it was very amazing to learn about it. I will join my voice to say I've done about 5 whys, but I don't know it would have been so helpful like this, because I before now I don't know how to apply the 5 whys to get to the root cause of any issue. But with you people, it was easy. Although it was not easy per se, it was very taxing, but what's working for. So I'm glad to be part of this. Thank you.
Thank you very much indeed. All right, we've got health leaders from all over Nigeria in the room with us today, and you're going to hear many different voices. We want to make sure that we hear from both men and women. We want to make sure that we hear from every region, every state, and as many local government areas as we can today, because this collaborative was truly massive. I'm going to remind you of a few of the numbers. First of all, what is this about? It's about children missing out on life-saving vaccination, and as health workers, the opportunity to come together to help Nigeria do better. This is a collaboration of the Geneva Learning Foundation in support of the Nigeria Movement for Immunization Agenda 2030, and we've worked closely with the National Primary Healthcare Development Agency and really our in-country partner, and we're proud to be working with UNICEF today. Now, one thing that is different in this event, we welcome and warmly so thank and honor our distinguished guests from state, federal, and international partners. Today, however, we are breaking with convention and we're placing the spotlight on those at the heart of our mission, and these are the voices of health workers serving local communities that we are honoring today. We also want to honor leaders of the Movement for Immunization Agenda globally, international observers who also joined the RCA exercise, and a reminder of what is the collaborative. It's really a new model for locally led technical assistance. We also want to really acknowledge the Nigeria Alumni Ambassadors, a unique network of immunization leaders who've been working now for years, since 2016 in some cases, really to strengthen health, to strengthen immunization, to learn and to turn that learning into action. So we do want to honor them and recognize them today. Now, this first peer learning exercise, working together, we demonstrated the potential for large-scale digital peer learning to address local immunization challenges across Nigeria. And you know who joined the collaborative. In the first 2 weeks, over 4,000 health professionals connected from all 36 states and more than 300 local government areas, 1,674 applicants, and over 36 states represented. These are the numbers from the 22nd of July when we kicked off the exercise. So again, in addition, 680 organizations joined, local government agencies, civil society organizations, many of them local and community-based. 38% women participants, 39% government workers, and representation, you can see 65%, from the LGA and facility level. About the organizations, we wish to honor them today. This is about localization in practice, local government agencies, civil society organizations, pre-service training institutions saying, yes, we are interested in connecting with health workers, supporting health workers, and connecting with other organizations that have that same commitment. Within the first 2 weeks also, Nigerian health leaders shared experiences, and this led to the publication of 2 collections of experiences shared. A very impressive set of insights, very varied also set of insights that may confuse some, but where you will be able to find potentially a relevant experience that makes a difference for you. So we now are going to ask you again, what would you tell a close colleague about your learning experience? I'm going to go to Charlotte to guide us to our next speaker. Oh, Charlotte, are you?
Yes, Fred, I'm here. So I'm going to be inviting, we have Esther Yakubu. I hope you're able to unmute yourself and to speak to us. And please do start by introducing yourself. Okay, Esther seems to be having technical issues, so we'll invite Adamu Dauda. Adamu Dauda, are you able to unmute?
Hello, good evening, everyone. This is Adamu Dauda from Bauchi State, Nigeria. I'm affiliated to Bauchi State Primary Healthcare Development Agency, the epidemiology units. I'm also a community youth leader in my community. I'm also work with a private facility where I involve in routine immunization activities. Yes.
So the question we have for you is, what was the most important thing you learned during this peer learning exercise?
All right. I've learned a lot of things, but the most important thing is group work. I learned how to work together with people. Hello, can you hear me?
Yes, please go ahead.
All right. I said I learned a lot of things over the course of this program, but one of the most important things is the ability to work together with different people from different backgrounds, from different settings within Nigeria. And I also learned that the 5 whys principle is the key to finding solution to almost every problem, not just in terms of immunizations. With these 5 whys, I realized that any immunization challenge or any health challenge can be addressed. And I can remember that day during the session when Jenny, I don't know whether she's in, Jenny suggested that this goes beyond the 5 whys. It goes to the extent or to the you do it continuously until you reach the final stage of the challenge you may face. So actually, these are some of the things I learned, and I will never forget them. Thank you very much for this opportunity, and I look forward to learning more from you guys. Thank you very much.
Thank you very much indeed. All right, let's now go to the next stage of our sequence. We have the story to tell about this first peer learning exercise. Some of you who are joining us on social media may be wondering, what exactly is this collaborative? Somebody invited you, somebody told you to, you suggested, recommended that you join. We're going to tell you the story in a minute. But first of all, we want to thank those we call the guides. As opposed to Sage on the stage, they're global and Nigeria experts on immunization who were kind enough to lend their support, their wisdom, their experience, and their expertise to accompany this initiative. I'm first going to show their names here, and then we are going to honor them individually. First of all, we have in alphabetical order by first name, Dr. Abdul Mumin Saad, Global Health Leader, Epidemiologist and Advisor at USAID. Charlotte?
We have Boma Otobo, that's a Global Health and Immunization Consultant.
And a happily retired deputy program manager at NPHCDH, followed by Chijioke Kaduru, public health physician and technical director at Corona Management Systems.
We have Dr. Ifeze Odigoma, that's a medical doctor with and also a senior registrar at the Nnamdi Azikiwe University Teaching Hospital in Anambra State in Nigeria.
Dr. Amaka Onubogu, associate professor of pediatrics and consultant pediatrician at Nnamdi Azikiwe University Teaching Hospital in Anambra State.
And we have Dr. Ibrahim Dadari from UNICEF headquarters, is a global immunization specialist.
Dr. Hamsuk Swomen, public health physician and global health and development strategist, who's the senior global health security advisor at USAID Nigeria.
And we have our very own Jeti Sequeira, that's a global health consultant and the immunization consultant for the Geneva Learning Foundation.
Professor Rosemary Ogu, consultant obstetrician and gynecologist at the University of Port Harcourt, and she's also the national president of the Medical Women's Association of Nigeria.
And we have Scholastic Kanjagi, that's the social and behavioral change specialist at UNICEF Nigeria.
Dr. Tokumbo Oshin, who's the director of high impact countries at Gavi, the Vaccine Alliance.
And Vivian Ihekweazu, that's the managing director of Nigeria Health Watch.
So these were our guides for this first peer learning exercise. We also want to thank and recognize them today. Of course, the main event for this ceremony will be to honor and recognize those of you who successfully completed the first peer learning exercise. And that is first why we are going to first tell you the story, so that those who were not with us for whatever reason, if you missed out on this first root cause analysis exercise, we're going to tell you a little bit, and you're going to hear firsthand from those who were successful in this first peer learning exercise about how it went and what it was all about. I note the many good comments. I'm trying to share some of them. Kaltimi Shoaibu, who says applying the 5 whys in the root cause analysis was definitely the most important learned experience. So first of all, the timeline, very quick, very rapid, very intensive, very rigorous, with tight deadlines. We launched on the July 22nd and finished on August 6th. And you'll be amazed by everything that Nigerian health workers coming together in this new way to help themselves and help each other were able to make a difference. Shifting from what we call old learning, in which you have a teacher who tells students what to do, what to learn, to new learning, in which everyone is connected to everyone in a different and new kind of pedagogical model. Time pressure. Incredibly high time pressure, 4 days to write the root cause analysis, 5 days to complete 3 peer reviews, and 5 days to submit a revised and improved root cause analysis. And at the time, what you found most useful, for example, was experience sharing, active participation. You told us the breakout group discussion was amazing and interesting. You said the brainstorming sessions, the combined efforts made the task interesting. And this was about activities, not content. Each one of you knows what your priority immunization challenges are, and we challenged you to dig deeper, to identify the root causes of those challenges. We began with what we call the Discovery and Exploration Day, where there was fast-paced collaborative knowledge construction. You had to come together in groups and figure out an immunization challenge and figure out very quickly how to use the 5 whys technique to figure out why the challenge happened and to identify the root cause. So we're now going to ask you, what surprised you during these first 2 days, where over 600 health professionals from all over Nigeria had to meet, connect, and learn together? Charlotte?
Thank you, Reda. Before I turn towards those with raised hands, I just want to highlight a comment from Okechi Zedibe in the chat that says this RCA was very impactful. I realized that I could do something about immunization without depending on huge funding and still make impact. So right now, I'd like to turn towards David James Ode, whose hand has been raised for quite a while. David James, I'm inviting you to unmute.
All right, David James Ode. Otherwise, let's
Okay.
go. to Phyllis Goody or Enosandra Uyebi or Hadiza Waziri, Amina Ibrahim. They were all ready to go. All right, we're waiting to see if Esther Yakubu and David James O'Day remember that to do the best that you possibly can to get ready to speak. There are many partners, stakeholders from Nigeria and internationally who are listening, who are going to form their opinion of what is this immunization collaborative on the basis of what they hear today. OKG NZDB says this RCA was very impactful. I realized that I could do something about immunization without depending on huge funding and still make impact. Charlotte, let me know when you've got somebody who's online and who's ready to go. Omobosede Bameru says, good afternoon. I want to be sure you are to let us know when to speak as I cannot see the unmute button. So Omobosede, that's very important. We explained it when we started. You need to raise your hand first. And we also want to acknowledge Adamu's a special thank you to Jenny for her guide and contribution. How is it going, Charlotte? Do we have a speaker?
Adamu Taladima Dangona has mic unmuted.
Yeah. Good morning, good evening, everyone. I am Adamu Galadima Dagona, a lecturer in Federal University Geshua. So I am representing Federal University Geshua as a collaborative. In fact, it is a great pleasure to be one of you here in this special day. So in fact, this kind of a collaboration of the Geneva collaboration with all the stakeholders have witnessed firsthand an impact of collaborative effort, driving immunization outcome and the community health improvement, which is work has been actively involved in virus immunization and public health immunization. So partnering with organizations like UNICEF, National Primary Healthcare Development Agency, and others. Most of the collaborative in the root cause analysis has been provided variable insight, which is actionable strategies. However, there are key areas of collaborative that will be further enhanced through the knowledge gained through this kind of RC, the five whys approach, which can be applied in any kind of sector. So first thing in strengthening it has strengthened the multi-sectoral engagement and also the coordination between the platform engagement for the local community and also capacity building for sustainable impact. So this RC is amazing. You can apply it through as an academia. We can be able to apply this in order to achieve the wide coverage of immunization, which are left behind for the various local government, more especially in the state. So therefore, in order to have a developed pathways for flexible and also acceptance of the immunization throughout the state and also Nigeria in particular. So this 5-Whys approach and RC have strengthened and also widened the horizon in which I can be able to integrate all those members of my own university community, more especially the university clinic. So we have staff that we have trained them, we have given them the insight of the using the 5 Whys in order to address the problem of untorn immunization. So therefore, this RCA system, it has institutionalized a policy framework and collaborative kind of an approach in which it can be able to address the immunization problem through the collaboration from the various stakeholders. Thank you very much.
Thank you very much indeed, Adamu Galadima Dagona. Skill development. Over 600 health professionals in those first 2 days learned to conduct RCAs on their local immunization challenges, and around 60 leaders really took up the mantle of facilitator and practiced their facilitation skills. When we asked you during those first 2 days what surprised you, you told us things like the concept of breaking into groups with unknown colleagues across the nation is really enlightening. You get views across different parts of the country and learn from them. You told us group work were more related, ideas were shared, and a lot of ideas that made me think differently, experience sharing and active participation of group members. But that was just the first 2 days. This was Tuesday and Wednesday. By Friday, you actually had to deliver a complete root cause analysis that was your own about your local challenge. And so this is where we want to ask you, what was the hardest part of writing, of doing your root cause analysis, and how did doing your root cause analysis help you with your immunization challenge? And I take note of the really excellent contributions in the chat. I'm able to show some, but not all of them. But we will be saving them and sharing them in the coming days. Charlotte, who shall we hear from next?
I'd like to invite Gloria Oji rather to answer these questions. And Gloria, please do introduce yourself. I hope you're able to speak.
Yes, I guess so. Can you hear me?
Yes, please go ahead.
Oh, okay. Good evening, everyone. My name is Mary Gloria Oji, and I am the president of the Network of People Impacted by Cancer in Nigeria. And I stay in the FCT. The hardest part of writing the RCA for me was that I ended up being surprised at the answer I got at the end of it all. So my perception at the beginning, because I was coming from the angle of, the HPV vaccine, the challenges that was faced during the creation of awareness and so on. But when I started asking myself the question, I came up with the answer at the end of it all that completely surprised me. And that was one of the things that I enjoyed about the collaborative. And secondly, during the peer review, I had the opportunity to meet very sound, salient individuals that made huge contributions that when I was rewriting my RCA, it came out better and my project was richer due to what I learned from the peer reviewers. In fact, the program was fantastic and I can't wait for the next one. Thank you.
Thank you very much indeed. Now, this was just step 2, step 3, and you remember the Friday, 26th of July, which was the deadline to submit your project. There was no extension because every one of your colleagues was dependent on you being able to submit your project, just as you were dependent on them. And you had to create and submit that RCA very quickly. Now, 410 of you were successful and submitted draft root cause analyses, and we'll see later 278 then submitted a revised and improved version. But here we are. What did you do once after you submitted your draft? Well, you were entrusted 3 RCAs from your colleagues who could be anyone from anywhere across Nigeria. So if you work in a facility or in a ward or in an LGA, it could be the root cause analysis of someone working in an NPHCDA at the national, at the federal level that you are going to review, which meant giving constructive, specific feedback. Or conversely, if you work at the federal level, you could be finding yourself asked to review you're someone who works in your under your responsibility or someone in a completely different area. So those were some of the possibilities. 308 of you completed 3 peer reviews and 229 received 3 peer reviews for your work. So the question here is a bit like the previous ones. What surprised you when you did peer review, which meant you had to take the time to read and give due consideration to what 3 of your colleagues wrote and analyzed about their situations? And then second part of the question, how did peer review help you to improve your own RCA? Charlotte, over to you.
Thank you, Reda. So I'm inviting Nduka Ozo, Charles Obiora, if you're able to. Okay, Nduka Ozo, over to you.
Yeah, good evening, everybody. My name is Mr. Nduka Ozo. I am the project director of Center for HIV/AIDS and STD Research. We have office in Bauchi, we have office in Lagos, and then we have office in Abuja. What really surprised me when we were reviewing is I was wondering why all these problems, when Nigerians can provide a solution to it, everybody that I reviewed his RCA seems to have an answer to the problem of immunization in Nigeria. And so I was so shocked at the level of capacity Nigerians in that program have. So if we have these capacities, why do we still have this problem of low immunization? Is there anywhere, what is going wrong? What is the problem? Is it from the leaders, or is it from the partners, or is it from the health workers themselves? Because everybody seems to agree on what to do. And when you look at them very, very deeply, you see that actually these are really, really issues that we need to address to solve immunization problem in Nigeria. So I was quite impressed with the level of knowledge, capacity a lot of Nigerians that participated in that peer review had. And on my own part, I thought I know a lot when I developed my own peer review, when I developed my own RCA. But hey, one reviewer came back and said, boy, you didn't do this very well. You didn't do this very well. If you had done it this way. And I looked at it very, very critical, and I said, oh yeah, I think I got it wrong here. So I learned a lot, and I'm happy I am part of this project. Thank you.
Thank you very much indeed. Now, when we asked you during the peer learning exercise, what did we learn together? You told us things like, I learned how to do a root cause analysis better than before. But you also said things like, I've learned challenges we faced in our communities aren't limited to us alone. Many health workers face similar and even more challenging issues. Then we asked you about eureka moments, those moments when you made a significant breakthrough in what you're able to understand, what you're able to do. And you said always apply. One of you concluded you were always going to apply the 5 whys to find out the root cause of any challenge you face in your work. Others said root causes often have systemic issues that need to be addressed in order to be solved, and issues seem to be simple, but somehow completed because they're interwoven, fused together. It requires multiple approaches. After peer review, this was not the end of the first peer learning exercise. And remember, we're talking about 12 days altogether from start to finish. Receive and apply feedback. You receive feedback from your colleagues. Some of the feedback may have been useful and good, some of it may not. And you had to make the decisions on how you use this feedback to actually improve your initial root cause analysis, to make it better, to dig deeper, to find the root cause that you can do something about, and to find the root cause that actually is consistent, related to your immunization challenge. So of course, here I'm going to ask you, what was the most helpful comment that you received from your peer reviewers who were colleagues from all over Nigeria? How did it help you to improve your RCA? Charlotte?
We have Modupe Owodjuigbe, whose mic is unmuted. Over to you, Modupe.
Good evening, everyone. Like she has said, I'm Mrs. Owodjuigbe, Clara Modupe, from Lagos State. Anyway, I joined as an individual because I'm a retiree from the Lagos State Primary Healthcare Board as the Director of Health Education and Health Promotion Services. So I'm not engaged with any organization right away, but I was invited to join by one of the SBC consultants of UNICEF. And to God be the glory, I joined and I found the program very, very interesting and pretty good. Well, I did all my RCAs, and I did my RCA, the WISE, and all other activities under that. And I did 3 reviews, the 3 peer reviews, but my own was among those that were not reviewed. And as well, I did not get any comment or any information from that. So the information that guided me to go on, to move on in the project, is the information from Charlotte and the other facilitators, as they have been they were guiding us that we should not worry, that we should use the experience that we gather from those that we were learning at the training. And I continued. I was not discouraged. Although I was on the launching day, I was on transit to London, so I could not join the launching, but I was not discouraged. The following day, I joined the project and I continued. Even when I was to stay with my family, I was with the project, and I know the project was very tasking, but then I was not discouraged. I was just moving on, and I made sure I finished the project. So I did not have any comments from anybody, but with the information and the comments of the facilitators, I was able to move on to the end of the project. So, and it was pretty good. I enjoyed it. I really enjoyed the project, and my knowledge was built more. So I want to thank the facilitators. And right from that period, I've started sharing with my colleagues that the project is a good one, and I'm inviting them to join whenever the project starts again. So I think it will build the immunization activities of the state, and we improve the coverage of Lagos State. Going with the project I wrote on Alimosho local government and submitted as my RCA. Thank you very much. Over.
Thank you very much indeed. Now, you can imagine the intensity. If you were not there for the collaborative, if you missed it, we're going to tell you at the end of this ceremony how you can still join and participate, because the story, keep in mind, this is just the first peer learning exercise. Afterwards, if we're able to continue the collaborative, if there's a collective will and support from partners and from you, health workers all over Nigeria, then the next stage would be to support each other to implement the activities that will tackle the root cause of the challenges that you found. So at the end of the collaborative, you submitted your revised and improved root cause analysis. So you really brought everything together and put it back to make your root cause analysis better. Some of you, actually a significant number, it changed the root cause. You said, well, after receiving feedback from my colleagues, I've realized that I did not go far enough, I did not dig deep enough, or I got the 5 whys wrong. And other people basically were fine, but just perfected their RCA. And so the question is, of course, how does your final root cause analysis reflect what you learned? What are you going to do differently in the future as a result of this RCA? Those are the 2 questions for you. And those questions came at the end of the peer learning exercise. And we're now a few minutes away from beginning the award ceremony for the certification. For those of you, of course, all of you are waiting for this. Charlotte, who shall we hear from next?
Gloria Chinyere Oku, your mic is unmuted. So please go ahead and answer the 2 questions, but please do start by introducing yourself.
Okay, thank you so much, Charlotte. Thank you, Reda. My name is Gloria Chinyere Oku. I work for Project Pink Blue, Abuja, as the program coordinator. And I had a very good time with this program, and I did my RCA and submitted. And after the review, I got some very encouraging feedbacks. Most people that reviewed my RCA felt I did justice to my 5 whys, and that was so encouraging because I was a bit panicky at the time of writing. I wasn't sure I was getting it right, so their feedback was quite helpful. And someone pointed out that I have to show what specific activities I could use to drive awareness. Since awareness is a core program of ours, I have to highlight specific activities that could drive the awareness, in local communities. And that was an eye-opener for me, because it's not just itemizing the problems, but we have to also itemize cost solutions and identifying already existing programs through which I could push for solutions in the problems identified in my RCA was quite eye-opening. And I was able to identify my existing programs and itemize how I would use them to solve the problem. And, I also had to look at available funding for this and, how I could integrate it into existing programs. And that was just the highlight of my revised RCA. And looking at it right now, I'm so proud of the work I did. And thank you to everyone that reviewed and gave me those honest feedback. It means the world to me. And thank you so much for this awesome program.
Thank you. So we want to know now, before we move to the awards ceremony for certification, we want to ask you this last question. We know there are some of you, many of you actually, so many hands raised in our Zoom studio. And in our Zoom studio, we have only those of you who are receiving certificates today. So please be patient. We thank you for your indulgence and understanding. We have been overwhelmed by this collaborative ourselves, and this is really a testament to the dedication and commitment. I want to take note of the comments around the high level of capacity in Nigeria and where then the barriers are. We're going to lower all the hands, Charlotte, and really invite those of you who were selected as speakers. If you'd like to answer this question, first introduce yourself, tell us what root cause did you find, and what are you going to do about this root cause that you found in the peer learning exercise. And please do now raise your hand again, and there hopefully we'll be able to go respecting. We'd like to hear voices from every region, every state in Nigeria, as many as we can, from both men and women in the collaborative. People from very different job roles, and whether you are from a facility, from a ward, from an LGA, working in your state, working at the federal level, we want to hear from everyone, because that is what the collaborative is about. The same whether you work for government, for a civil society organization, for the private sector, you belong to to this great family of the collaborative for immunization. Charlotte, who shall we hear from next?
Usman Muhammad Tuku Reda has his mic unmuted and hand raised. So, Usman, over to you.
Hello, thank you so much, Charlotte and Reda, for giving me this kind of opportunity to express what in this kind of monumental event. I really appreciate. First of all, my name is Usman Muhammad Tuku from Kano State, Nigeria. I have worked currently, I just finished my work with a new incentive in Sokoto State. So I'm really, really happy being part of this exercise. I learned a lot. So based on the question asked, what root cause did I find? Now I find one of the simple root cause. Initially, we are neglecting it because it's very, very simple. But now I realize through what I learned from this program, this root cause is very, very key. So I have interest now to start working on it so that to find the solution for it. The root cause is maternal workload to caregivers. This maternal workload to caregivers is very, very key, because especially in the northern part of Nigeria, the caregivers, they are the one responsible to take their children to the immunization health facility for their immunization. So sometimes there is a lot of work for the caregivers in their house. So sometimes they want to take the child to the facility, but they are so engaged in doing some kind of work at home. So they don't have time to take the children. So definitely that children will be missed. So now through this, what I learned from this program, I have to sit down and solve this kind of issue and educate the caregivers to make collaborations with their families, with their friends, with their relatives, so that one day, one time, if the caregiver, she's busy, she can't have time to take their children or their child to the facility, then she can make collaboration maybe with her elder sister or her younger sister or even her husband to help her to take the child to immunization so that the child will not be missed. Thank you so much for giving me this kind of opportunity. I really appreciate it. Over.
Thank you very much, Usman Mohammed Tukur. Charlotte, who shall we hear from next? And it should be logically a woman from a different part of Nigeria, right?
Exactly. That's why I want to apologize to Ibrahim Abdul Rashid, and I'm inviting Selina Enyoha. Selina, are you able to unmute? Selina Enyoha. If not, we have Victoria Okonji.
Hello.
Yeah,
are you hearing me?
Yes, loud and clear. Please go ahead.
Okay, this is Selina Enyoha. The Executive Director, Citizens Health Education and Development Initiative in Abuja. and I'm joining you from Pennsylvania, America. Good afternoon, everyone. My own route analysis was on immunization, the community's immunization rejection by the community. So what happens is that often at time when we plan, I am a public health specialist. Often at time when we plan what we want to do, we don't even consider the community. We just, as if we are imposing what we want to do to the community. And from my 5 whys, I realized that community involvement in whatever we are doing, especially on immunization, is very, very key. The mothers, I will involve the community leaders, I will involve the community groups, especially the women group, for advocacy. Because when you carry the community along, they buy they buy into your program and they accept it, they go with it. So it is very, very key. So that's part of what I want to do. And unfortunately, if I have the fund, I would have reviewed it, because we worked in Gwarimpa ward. We realized that we were to reach about 820 children, only about 340 were reached as of the time we wrote this root cause analysis. So it means that we haven't done our work very well. But from my why, the 5 whys, I realized that we really need to do more on that. Community involvement in whatever we are doing, and using their own language they will understand. And having community volunteers, it is very, very important in what we need to do. I really thank the organizers of this program. I have even recommended a good number of people to join in the next dispensation. And I love their patience, because at times when you listen to questions some of us were asking, they seem childish, but they were very resilient. They were very patient to attend to us. So that was really very, very good. Awesome program. Thank you very much.
Thank you very much indeed. And I have another. So let's go to Maimuna Tata. Maimuna Tata, are you there? And are you able to speak to us?
Yeah, I'm here.
Okay, wonderful. So I'd like to ask you a series of questions this time. First, do introduce yourself. Tell us, as we just heard, but your story. What root cause did you find for your local immunization challenge? What are you going to do about this root cause? And then the next question that we want to submit to this assembly of exceptional immunization leaders who made it to the finish line of the first peer learning exercise. Should this collaborative for immunization continue? Why or why not? So really 3 questions. What root cause did you find? What are you going to do about this root cause? And then should this collaborative continue? Over to you, Maimuna Tata.
Okay, thank you very much. I am Maimuna Tata from Kano State. I am a health worker in Zanya Primary Healthcare Clinic in Bunkura Local Government, Kano State. My root cause, the root cause that I found at the end of the day happens to be my reason happens to be my health facility happens to be a new facility. That was why it wasn't providing routine immunization. So at the end of the day, I found out that there are a series of things or series of challenges that led to this. In the first instance is from the top, the series of channels that the health facility has to pass through before it is being registered into the DHIS platform, which is a long process. So what I actually did now was to collaborate with the immediate health facility that was serving the community before, so that I would get vaccine from them and then provide health routine immunization in my health facility. Then with the community coming to my health facility, providing them with the routine immunization. Then my report is being sent back to the health facility so that it can reflect. Though it is not reflecting my health facility, it is reflecting the other health facility. But the good thing is that the two people are reached and they are immunized. Thank you.
Thank you.
And then the second question.
Yes, indeed. Yes. Should the collaborative continue? Why or why not?
The collaborative should really continue. It's a must. It must continue. We need it because if you look at it, this is something like a global peer learning, and then the shared knowledge had a great impact on everyone that joined this collaborative, and it enables health professionals from around the world, or let me say from Nigeria, to exchange ideas. And these ideas that were shared, and then the challenges that were shared, we learn from each other. And this peer-to-peer learning, it gives a kind of innovation, and then it gives us a new insight into our problems. We shared a lot of problems together, and we were able to get solutions to them. And also bringing together individuals from different regions and backgrounds. The collaborative has created a space where diverse perspectives can converge, so that creative solutions to complex immunization challenges were achieved. So I think with this, the collaborative should really continue. I would love it to continue. Thank you.
Thank you very much indeed. We're going to ask you this question. We'd like to hear from a few more of you. Should the collaborative continue? Why or why not? And this is very closely linked to the preceding question. You found the root cause. Those of you who are here with a Zoom studio are those who successfully completed the first peer learning exercise. But what are you willing and ready to do? What are you perhaps already doing about this root cause that you found? What has it changed about how you're going about your activities? But really, the key question is, should this continue? We started something together with UNICEF, with NPHCDA, with the support of Gavi in July. And in just 2 weeks, this is what we were able to do together. Is this the beginning? We called today's ceremony the commencement, the beginning, or is it the end? You will have to be the ones to tell us. Charlotte, who shall we hear from next?
Reda, so I'm going to invite, so we have Victoria Okonji, whose mic is unmuted, and then afterwards, Okechi Zedibe.
Hello, Charlie. Thanks for this wonderful program. Thank you for all the opportunity to express ourselves. I'm by name Mrs. Victoria Okonji. I'm a nurse in view, and I'm also
okay, looks
like
a
lot. So
Victoria, for me, you're breaking up. Yeah, unfortunately, you're breaking up. So I don't know if it's your connectivity or your microphone. Please speak directly into your microphone. Let's try. Otherwise, we'll ask you to write your comment in the chat and we'll share it on screen.
Can you hear me?
Yes, now we can. Please go ahead. Tell us, should the collaborative continue? Why or why not?
Yeah, it should continue. I'm by name. Sorry, let me introduce myself. I'm by name Mrs. Victoria Eze Okonji. I'm married to a medical doctor, a mother of 2. So I've also learned so much about the program. Also, I've learned so much about it. While writing my root cause, I discussed with my husband about it because he's a medical doctor. So he gave me his own opinion about it, and I looked into it and I saw that it was true. In my environment here, the immunization is actually a low outcome of immunization around here. Women don't like immunizing their children. I don't know why. They'll be like, I'm busy, I'm in the market, I cannot go and start making a queue in the hospital just to go and immunize a child. So I discussed about it with him. So he was like, we can work on it. So I think that those opportunities is a very good opportunity that to actually bring them around and also share the experiences with them and tell them the importance of the vaccination to a child and how they could also partake in this program. Thank you very much.
Thank you very much indeed, Victoria Okonji. I believe our next speaker is Okechi Nzedibe. Okechi, the floor is yours.
Okay, thank you, Reda and Charlotte. My name is Okechi Nzedibe. I'm a pharmacist and a public health specialist. I work for His Tribes Nigeria. Here, I'm practicing in Akwa Ibom State, and I do some projects with the Ministry of Health also. The collaborative should continue. And why I say so is that the root cause analysis, and we have our plans in place. We simply just have them on paper. We need to get to the field. And by the time all the health professionals involved at the different corners of Nigeria implement what we have in our root cause analysis project, there will be a huge difference. And when the huge difference is noticed, more people will also buy into this. And then we'll get more attention even from other, so probably from donors or some organizations who will give us some technical assistance.
We just lost Ogechi and Zedibe, but we did get the main point, and we appreciate your contribution. Thank you very much indeed. All right, I believe, Charlotte, we have been waiting for this moment, and this is a commencement ceremony, so today is the day. We do have time for one last speaker. I can tell, Charlotte, that you have, and there's so many hands raised. We're already over time. We're going to present and award these certificates and read your name and the name of every other member of the collaborative who successfully completed this exercise. So we thank you for your patience and appreciate your understanding. Some of you who we invited specifically to speak have not been able to do so. We can only apologize and plead for your understanding. We hope this is indeed the commencement of the collaborative and that there will be many other occasions to share. Over to you, Charlotte.
Yes, Reda, you want Ibrahim Abdul Rashid to say a word before we proceed?
Sure. Yes, Ibrahim Abdul Rashid, a warm welcome to you. Tell us who you are, where you work, and if you think the collaborative should continue, why or why not?
Okay, good evening, sir. Thank you very much for giving us the opportunity to partake in this exercise. Ibrahim Abdul Rashid is my name, and I am community program officer for GIP Africa in Zamfara State. And to me, this collaborative should continue. Why it should continue is because we already have the problem, that is the low turnout of the vaccine. That is, people are not willing to go. They don't want their child to be vaccinated. So we are now digging to know what are the root cause, what is causing them not to go. So knowing the problem is like you are solving 70% of that problem. You can only solve a problem when you have when you know the problem. So to me, the collaborative should continue. Thank you, and over.
Thank you very much indeed. All right, the moment has come. I think in response to your voices calling for the collaborative to continue, I think we're going to discuss with our team and with our partners, maybe consult some of you, but it feels like each of you works within the immunization system, within the health system. Perhaps we could call on you to actually present the collaborative. So many have heard of it, but many more do not know what it is, do not know what you have done. So perhaps this is one of the ways in which we'll follow up so that if the collaborative is to continue, it'll be once again, it does not make sense without you, and it'll be because you would like it to. So we have more messages coming in, but we are now moving to the moments we have indeed been waiting for. So today we're recognizing 410 members of the collaborative who will be receiving their certification, 308 who participated in peer review, and 278 who submitted revised root cause analyses. A reminder of the principle of certification. What we certify is not attendance or participation, but it is the production of knowledge, the production of analysis, exercising your capacity to think critically. That is what this is and has been all about. So, without any further ado, we're going to kick off this ceremony. And together with Charlotte, we're going to start with the names. And this is why we ask each and every one of you to be present in attendance, so that in front of your colleagues from all over Nigeria, you could hear your name and see the certificate that you will be receiving by digital means. Here we go. Charlotte, shall you kick off? Even though I've been practicing, her name will be going from A to Z by first name. So here we go.
Yes, brother. So the first certificate goes to Anu Oluwapo Ade Bimpe Rotimi. Congratulations.
The certificate is awarded for drafting a root cause analysis of a local immunization challenge to Abba Mohamed Isawa.
Aki Usman.
Abdullahamin Abdullahi.
Ayi Ahmed Kandiwa.
Abdullahi Isasani.
Abdurrahman Abubakar.
Abdul Wahad Suleiman. Abubakar Aminu.
Abubakar Bagodo.
Abubakar Barade.
Abubakar Buhari Bello.
Abubakar Hashimu.
Abubakar Ismat Owandi.
Abubakar Yusuf.
Adamu Abdullahi Baba.
Adamu Abdurrahman Mamba.
Adamu Muhammad.
Adamu Bukar.
Adamu Dauda.
Adamu Galadima Dagona. Adeleke Gebenga Anuolu Wapo.
Adeleye Akim Oladele.
Adele Ni Kamoru.
Aderikola Abdulaziz.
Adeyanju Wahid Adeyemi. Charlotte.
Adeyemi Babajide.
Adigun Priska Funmito.
Adiole Confidence Chidiebere.
Ahmad Adamu.
Ahmad Mariam Adam.
Ahmad Mohammed.
Thank you.
Ahmad Mohammed Ahmad.
Aisha Ahmad Mohammed.
Aisha Aminu Ibrahim.
Aisha Usman Bashir.
Ajaibu Jennifer Ifeoma.
Ajiji Ishaya Niyam.
Whether
Yes.
Akintelu Adetola Matlo.
Akinsola Oluwabusola Oluwakemi.
Akinumi Olu Bayode Titus.
Akinyemi Opeyemi Busayo.
Alawiyatu Usman Ibrahim.
Alexander Ichi and G.
Aliyu Ahmad Alaji.
Aliyu Hafsat Fadila.
Ambassador Dr. Abdurrahman Kitili Hudu.
Amina Abubakar Isa,
Aminu Kakale,
Amos Ibrahim Agwam,
Anas Chika,
Anas Haruna Ruga,
Anga Fatima Inusa,
Anur Abubakar,
Dore Awunde,
Arum Adamu Bulus,
Atayu Dan Ali Mustafa,
Ata Bilkisu,
Awalu Alasan,
Awal Jigado Mohammed,
Aye Bameru Omobosede Yetunde,
Ayuba Ebenezer Waziri,
Azimbe Kagaye Usman,
Azuka Norfor,
Abamai Maina,
Baba Shehu Ahmad,
Akko Emos Yes,
Bala Steven Shagaza,
Alta Okole Mercy,
Bashar Abdullahi,
Asha Aruna Malafa,
Bashiru Aliyu Gada,
Ashiru Chinade Adamu,
Bashir Abdullahi,
Ashir Abubakar Dawaki,
Bello Ayuba,
Elo Bekisula Blessing,
Bello Haruna,
Benjamin Tolulope Ikele,
Blessing Ogeni,
Blessing Yepri Obadiah,
Urema Kabore,
Brenda Belema Ichoma,
Bridget Tarimotimi Amula,
Ama Adamu Gawa,
Catherine Uchena Charles Obiora,
Charles Nwamdi Obiora,
Chiamaka Blessing Onwugaram,
Chidima Judith, Namani,
Christiana Za,
Ukuma Matthew Ogonaya,
Dabo Jennifer Swat Kasa,
Damulat Nancy Boniface,
Dan Abu Michael Ngebede,
David Fumilayo Alice,
David James Ode, Diane B. Mandahinog,
Ayan Manda,
Dixon Margaret Ekong,
Dominion Michael Bassi,
Dr. Julius Michael Iorwese,
Dr. Mary Obi,
Dr. Aisha Kadai,
Dr. Tine Catherine Beze,
Dr. Joanne Ejembi,
Dr. Okala Kennedy,
Dr. Seydou Amadou Traoré,
Eken Oko Okanti,
Edejona Oga,
Edward Innocent Obe,
Egunjobi Anifat Owo Omowumi,
Ejio Gugu Vitus Chipweze,
Eleyinmi Olutoyosi Funmilayo,
Emefesi Priscilla Okafo,
Emmanuel Jacob,
Emmanuel Berry Ohai Ogaru,
Emmanuel Suleiman,
Emmanuel Ibochiki Okasi,
Enechukwu Chinwe Ernestina,
Enwere Nancy Oluchi,
Enio Selina Acuna.
Ephraim Samuel.
Esther Peter.
Esther Titilayo Omojo.
Esther Yusuf Yakubu.
Eswai Ikpi Polycarp.
Eunice Ali. Ezekwona Ukamaka Charity.
Robert Akbara.
Eze Amara Chukwu.
Oluwatosi Tangodele.
Faiza Said Maikudi. Fanny Onokwu Ogwo. Fatima Abdullahi. Fatima Abubakar. Back to you, Charlotte.
Fatima Husseini.
Fatima Mohammed.
Fatima Zara Abubakar Otaro.
Felix Mary Ozuchi Okpechi.
Felix Konde Yama.
Gaddafi Inuwa Musa.
Bello Matthew Ayuba.
Gloria Anyanwu Oniyin Yechi.
Gloria Chinyere Oku.
Godia Maman.
Grace Eliocho Sule.
Gregory Agogo. Habiba Ishaya.
Habiba Michael Achiko.
Hadiza Umar.
Hadiza Waziri.
Halima Usman Al-Khamis.
Ida Mohammed Yehu.
Haruna Isa.
Haruna Nafisa.
Hassana Abdullah Raf.
Hassana Waziri.
Hassan Abdul Salam.
Hassan Muhammad Mustafa.
Hassan Mohammed.
Hawa Umar Buhari.
Hayatu Aliyu Bala. Husseina Abdul Rauf.
Husseina Aliyu.
Hira Usman Dawa.
Echiole Julius Uchechukwu.
Ibitunde Abayomi Ibitunde.
Ibrahim Abdullahi Maikano.
Ibrahim Abdul Rashid.
Ibrahim Abubakar Oselo.
Ibrahim Jacob.
Ibrahim Mwansam Dalato.
Ibrahim Muhammad Maigari.
Ibrahim Musa George.
Idris Saleh.
Human Patient Ken Guvan.
Ikwu Obiajeri Ethel.
Nikwa Christian.
Ilochi Stephen Namdi.
Emmanuel Angela Eringa Ne Ukachukwu.
Innocent Udemezue. Isaac Yeboji Ali.
Peter Hassan Khalifa.
Issa Tanko Faje.
Isaiah Yakubu.
Ishak Abubakar.
Akbar Mohammed.
Ismail Yau.
Ado Ali.
James Sado.
Camila A. Basiru.
Jamila Hamisu Mayali.
Shwaibu Ahmed.
Jesu Pemiwale Adeniji.
Don Emmanuel.
Josephine Ohunene Alex Abedo.
Josephine Bariku. Joseph Bariku.
Joshua Baba. Kabiru Sule Sadiq.
Grace Jonathan.
Kaltimi Shuaibu.
Altime Abdullahi.
Kamal Yusuf.
Ayode James.
Kezi Gift Niela.
Kofi Nyere.
Ladi Adamu.
Akita Oyeleke.
Lawal La Omorumi Fatima.
Awan Kumar.
Lilian Mutua.
Loretta Ota Ahupeme.
Lucy Odachi Ochepa.
Sam Danya.
Lydia Baba.
Magaga Abashe.
Magaji Garba Adamu.
Maimuna Mohammed Awal.
Maimuna Tata.
Han Roda Emmanuel.
Maman Salihu.
Mansur Mohammed.
Margaret Idoko Ene.
Mary Gloria Anunika Orji.
Mariama E. Idris.
Mariam Kabir.
Mariam Umar Abdullahi.
Mariam Yakubu.
Marian Mustafa.
Matthias Bayaki.
Mercy Fatima Umar.
Mrs. Mercy Twaila Maigoje.
Michael Olabode Tomori.
Miss Bahu Kuba.
Misol Nanzem Jatao.
Mohammed Adamu Sule.
Mohammed Garba Laka.
Mohammed
Mohammed Isa. Mohammed Saidu Ibrahim.
Mohammed Sani Isa.
Moses Elia Danga.
Mrs. Fatima Adol Garba.
Muazu Haliru Muazu. Mohammed Al Hassan. Mohammed Nasir Umar. Muinat Abidemi Yusuf.
Adamu Mohammed.
Muogalu Ebere Favor.
Alaji Rufai.
Musa Gambo Ashimu.
Ismail.
Musa Umi Umar.
Bahu Abubakar.
Mustafa Abdullahi.
Papa Lawal.
Mustafa Mohammed Chidawa.
Papa Mohammed Said.
Mustafa Umar Mustafa.
Amir Abdul Kadir.
Nafisa Isa.
Asika Ahmad Haruna.
Nasiru Musa Adamu.
Ayub Akram Stewart.
Nduka Ozor.
Nicholas Ashama Said.
Nura Bawa. Nwali Nana Confidence. Nwigbo Mariam Esther. And Zenwa Blessing Chinoniram. It looks like, unfortunately, we've lost Charlotte due to connectivity issues. We hope she'll be back. And we thank you. We really, really appreciate you. We're pleased and honored to be the ones awarding certificates today. I just want to keep going. Charlotte, let me know when you're back and able to rejoin. Obiageli Victoria Okeke, Obia Julu Wariboko Treasure, Odeyemi Grace Montunyar Rayo, Odong Vivian Francis. And we take the time to do this reading because we know how hard you worked, how intensely you were committed to completing this first peer learning exercise. Ogbu Miracle, Oguni Elizabeth Omoboade, Ogunwa Chinedu Esther, L.J. Oma. Ogunwa Chinedu Esther L.Jima. Ojeania Princess Ada. Charlotte, are you there? Okay, it looks like we've lost Charlotte Mbu. She very much wanted to be here for this moment so we could do this together. But we need to get to the finish line as we did with the peer learning exercise. Ojo, Oluwafemi, Ezekiel, Okechi, Ebere Chukwu, Nzedibe. Oke Dorcas, Odunayo. Okay, Stella, Olusola, still have good hope we'll hear Charlotte's voice again today. Okolo, Oniinye, Chigozie, Okonji, Obianuju Victoria, Okorie and Kechi chosen. Olani Sunday, Oluwada Milare, Olao Tunyombo, O George, Olatunde Engbolahan Ojeinde. Olayode Olanrewaju Akanfe. Ola Kinlalu Sefunmi Titilope. Olusegun Babayeju. Olutun Sanusi Oladuni. Oluwakemi Oluwagboun. Oluwatoki Babajide. Omini Peter Onimi. Onwukwe Oluchibuchi, Oninyechi Henry Chukwe Uebuka, Opadoyin Funilola Antonia, Opara Joy Nkiruka, Oshia Beatrice Mingiyi. We ask, even if your name has been read, to stay to the end to honor your colleagues. We see a few people have left, but almost everyone is still with us. So you can honor each other and earn the recognition you deserve for the diligence and the commitment and the effort that Oteba, Takawali Talaba, and 409 others put into this work for the first peer learning exercise of the Immunization Collaborative. Mrs. Owo Juyigbe Modupe Clara, Pamela Pama, Is Okafor Emefesi, Benina Andrew, Philip Stephen Ijudigal, Phyllis Odebo Peace Gude, Professor Rosemary Ogu, Professor Becky Tagbo, Promise Chioma Aloisus, Kudus Olajide Lawal, Racheal Chinenye Nwachukwu, Raji Kafayat Temitope, Rashida Abdullahi, Rashida Musa Mukadas, Rebecca Akinduro, Rebecca Bello, Rebecca John Bulama, Rhoda Samaila, Richard Dauda, Rizwan Ahmad, Rosemary Adejo Adaji, Rukaya Mohammed, Ruth Gwanzuwang, Sadatu Abubakar, Sabatu Elizabeth Danladi, Saba Umar Mohammed, Sabitu Sanusi, Sadiq Nasiru Garba, Salisu Abdullahi, Samson Ugochukwu Joseph, Samuel Moses Ubans, Samuel Sule Ajansan, Sani Hassan, Sani Sule Mashi, Shawa Michael, Shuaibu Ibrahim Takai, Shuaibu Sadu Dabai, Shua Habil Ibrahim Bunu, Sibeudu Naemeka Edozi, Sidi Isa Mohammed, Sirajo Isa Yunusa, Sodangi Chindo Adam, Solomon Adamu Ibrahim, Suleiman Umar Gabi, Tabitha Dauda Lagado. Please remember this day today is the 26th of September, more than a month after you completed the first root cause analysis exercise of the Immunization Collaborative, as did Tarbi Niagba Jacob. Awose Oluwatomisin Victoria, Tegan Joseph Musugu, Tejumola Oyebola Olubunmi, Temitope Adepoju, Tijani Bukar Tijani, Tina Hirogama Agbonima, Salah Abdullahi Namaska, Uchena Endubuisi Benson, Uche Maduako Franklin, Ugeni Iloabashi, Uguanya Rebecca Nwaniego, Ukamaka Gladys Okafor, Ukume David Margaret, Umaru Malabamba Zaifada, Umar Abubakar, Umar Aliyu Jawahid, Umar Bello, Umar Nasir, Usman Aladu, Usman Mohammed, Usman Mohammed Tukur, Usman Salihu Kudu, Usman Sarki Abdullahi, and we ask Jennifer Dabo and others, once you have seen your name, please stay to honor your colleagues. Stay with us till the end if you can. Usman Tijani, Uthman Alao, Uyebi Eno Sandra, Victoria Jones, Vivian Ben Obiagu, Vivian Chizoba Ajoku, Wesley Joseph Amza, Yahaya Abubakar, Yahaya Al-Haji Ibrahim, Yahaya Baba Hassan, Yakubu Esther Shama, Yakubu Suleiman, Yusuf Shabi Atika, Oreo Lua, Yusuf Ahmed Mundi, Yusuf Bashari, Yusuf Mohammed, Zainab Ibrahim Hassan, Zainab Shehu Turaki, and Zainab Umar, Zainab Usman Gele, Zeblon Oluwayomi Joseph, and last but not least is Zubairu Umar Lamba. I hope that Zubairu is in the room with us. If so, we thank him for his patience who is watching online. This has been the commencement ceremony of the first peer learning exercise of the Nigeria Movement for Immunization Agenda 2030 peer learning exercise. We thank you for your attention, for your diligence, for your commitment, for your leadership. We're very proud and honored to have worked with you. I'm going to finally be able to share some of the messages, the congratulations we've been addressing. Let me see. I'm not going to be able to keep up with all of them, so please. And I believe that Charlotte is back. Charlotte?
Definitely, Reda, and I'm so sorry you had to do this on your own.
Okay. We missed you. I missed you, I must say. All right. So many congratulations going by. We're going to finish. To say this, we call this a commencement. So please, if you have your final messages, do type them now. We're not going to be able to go back to show all of the congratulations, but what you're feeling right now, please type it into the keyboard. Give us at least an emoji, just like Fanny Ogu just did. We're going to show A few final messages before we go. And for anybody who did not see their name, we always have a few people who miss their name when it comes up, so don't despair. And hang in there, we'll be following up. But thank you very much, says Rachel. We love you too. We love you back, and we hope this is love across Nigeria for children and families and the fight against vaccine preventable diseases. For those of you who did not earn certification of the first peer learning exercise, you're still a member of the family of the Nigeria Immunization Collaborative. Thank you. And you can see it is possible with this first group that has shown the way. And we look to you to think and figure out if there will be a second chapter to the story of the Immunization Collaborative. The certificates will be sent by email, so check your email, make sure our emails are not going to spam. And thank you, Chinwe Enechukwu, and every and each one of you. We'll keep going for a few minutes as long as there are messages. We can even open up again if there's anybody who'd like to share what they're feeling, not just a message in the chat. Raise your hand, we'll try to go to you. We'll extend this session. This is truly exceptional. It marks the commencement, completes the first peer learning exercise. If you have anything you'd like to say before we go, this is your chance. Let's go to Mrs. Zara Abubakar Otari.
Hello everyone. I'm so happy.
Hello. Ibuchena Benson from Abia State, had that case for better health organization. I'm so proud to be honored with this certificate from the Geneva Learning Foundation, the UNICEF, and the NPCHD to be partner of this collaboration with Nigeria. And as you can see, I believe from this step forward, we will ensure that Nigeria have a better phase of immunization that will roll out to a successful end. Okay, and I hopefully that as a 2030 immunization will end in Nigeria, and I'm saying that this honor privilege to also carry out this root cause analysis, especially seeing that community-based organization, especially key populations, to partner with the NPCHDA in actualization of this goal. And as you can see, I'm hopefully to see that the next stages of this root cause analysis, wherever it will take us, I'm ready to add my own impact. And it's another eye-opening. And I've get to unite with all my community stakeholders here in the Abia State. I've educated them. Thank God for this root cause analysis to make me to understand the 5 why. And this 5 why is something that has projected me to stop.
Thank you.
All right, let's hear our next speaker. We've got a number of microphones unmuted, so please show the family. Let's show all of those who are listening. Let's hear your final voices. If you have a message, something that is in your heart that you want to share with the family, this family that is the Immunization Collaborative, now is the time.
Thank you, Reda. Thank you, Charlotte.
Thank you.
I want to thank you for the impact. It is enormous. And this is Becky Tabo. I want to thank you for the impact. It is enormous. And, just like you said, it's not participation alone, but knowledge production. It has even become habit. Even today, during our meeting in our workplace, we had to apply the root cause analysis to address an issue. So it has become part of us. Thank you so much.
All right, all good things must come to an end, and we must now close this ceremony. We are 38 minutes over time, but this was such a unique opportunity and time. Yes, go ahead.
Okay, yeah. Yes, I'm talking from Namdazikwe University Teaching Hospital here at Nnewi. Well, really grateful for the opportunity. Like my other colleagues have said, you have stirred up our hearts. I would definitely love that you guys take more cohorts, and more importantly, keep tabs with those of us here and ensure that we move from the RCAs to action. What we need is action. That's what will change the narrative. So we can do things on our job. So I would encourage the collaborative to keep an eye on all those that receive certificates. Great work, everyone. More grace, everyone. Thank you.
Thank you so much. Thank you so much, Reda. Thank you so much, Charlotte. Thank you so much for all that you have done.
Just want to ask.
Thank you, Reda. To reach to Nigeria Immunization. It was wonderful to be part of this program. And I want to tell you that me and my organization, we have already started developing partnership with some other organizations internationally to look at how we're going to do something different from this program. It is a very big capacity building exercise. It's a very knowledge impacting exercise. We want to thank and appreciate the Never Learning Foundation and the Nigeria Primary Healthcare Development Agency, UNICEF, and everybody who have participated in this program. But like what one of my colleagues have said here, this is just the root cause analysis. We need to start the implementation. Immunization is not going to end in Nigeria, but the uptake of immunization will be increased from the knowledge and experiences we have shared and the knowledge we have gained from this. I'm sure that a lot of health workers in this program will go back and start developing new strategies and apply what we have learned here so much. My name is Mr. Ndoka Ozo. Thank you.
Thank you.
I just want to ask, I really want to appreciate TGLF, and I want to ask a few questions.
Please go ahead.
Now that we're finished, now that we are done and we've received our certificates, are we now officially TGLF ambassadors? Then secondly, because I used to see they will write TGLF ambassador, means I want to put that in my name. So are we now officially allowed to use it? Or if not, what is the next step for us to embark on with TGLF so we can officially become ambassadors? Because this is one ambassadorship that I will be so proud to use as my name to work with and to also propagate the mission and the goal of this collaborative. Then secondly, please, for those who didn't get certificates, even after submitting the revised copy during the revised submission time, are they still going to get a certificate, or till maybe another opportunity when it comes by with TGLF, then they can proceed and hopefully participate fully with all resources are available? Thank you so much. Thank you once again. Thank you so much. Thank you.
Those are two great questions. So first of all, you may now consider yourself alumna if you're a woman, or alumnus if you are a man, of the Geneva Learning Foundation now that you have earned your first certification. However, you are not yet an ambassador, which is really earned through continued dedication and leadership to promoting peer learning, to promoting leadership for change in Nigeria and throughout the world. Now, for those who were not certified, you will receive a certificate of membership in the Immunization Collaborative, so that you may show that even though this time you are not able to directly and actively contribute, you are still a member of the family. We're going to have to stop here for the sake of time, but we know. Yeah, but thank you for those questions, and really congratulations to each and every one of you for the dedication, the hard work that has gotten you to this point.
I'd like to say thank you for contributing platform floor. Because never an easy task, but what we have promised you. And then on the second hand, I like to say all these things are being carried. The RCA from this end was carried without bias. I can assure you, I can tell you this for free. And then all these things are what we can put into action. It's achievable. Thank you.
How much did you collect?
Okay. Thank you so much for the